Congratulations, you made the smart decision to move to objective strength testing and have purchased a handheld dynamometer. But now you have to decide, what position do I set up in, and do I need external fixation or not? Hi, my name is Jacob. I'm the owner of Peak Force Systems, here to talk to you about fixation, external versus otherwise. So you've seen our other videos. If not, check it out. Basically, what we recommend is first thing you do when you buy a dynamometer, especially if you intend to use it in a push setup, is you take it out of the box, assemble it, and then you find a wall. And what you're going to do is you're going to push into the wall as hard as you possibly can. And that's going to give you an upper bound of how much fixation you have capable for you when you're testing your patients. That way, you know if you're doing a test with a real live patient and whatever joint or position you're in, if you get close to those limits, well, then you might consider maybe I need to pull out the big guns because I might be losing against the amount of force that they can create. We're big fans of external fixation, but we also realize that clinicians are busy and may not always have time to set up very specific, rigorous tests for every single plane of testing for a specific joint or a series of joints they might be interested in. So we have to balance between what is the absolute best optimal test versus what is feasible, quick, but also still reliable in the clinic. So our recommendations are use something that is certainly reliable. If you're noticing differences between trials, well then, your test probably isn't working. And yes, for sure, we are big proponents of external fixation, whether that's in a pull configuration or a push configuration. Both are great options. Just depends on what you're testing. And if needed, so certainly for things like quadricep or knee extension strength testing or seated plantar flexion strength testing, we would advocate that always those tests are going to require some external fixation. But you're going to have to know what works best for you as a tester versus the size of patient that you have. And you might need to vary that in a case-by-case basis. Check out our website. We have a free to download flow sheet decision tree that will walk you through how to choose if your test is a good test. It's free to download. You can find it at peakforcesystems.com and just click on the education tab. Thanks for watching.